And now on to a fascinating Louisiana history lesson. Along the River Road, linking antebellum homes in South Louisiana, sits an outlier, a plantation that served as a medical prison for people with leprosy. The former Gillis W. Long Hansen's Disease Center holds a bittersweet chapter in Louisiana's history as ground zero in the fight to cure a disease known as the biblical scourge. I'm taking you on a tour of the National Hansen's Disease Museum, which recently opened again after renovations. Woodlawn Plantation, known as Indian Camp Plantation, sits on a bend along the Mississippi River. Today, the Louisiana National Guard operates out of the estate that once anchored a national hospital for leprosy. The neighboring museum tells the story of hundreds of patients quarantined there and the medical breakthrough that freed them from forced exile. Hi.
Hi, Karen. Welcome to the National Hansen's Disease Museum.
Thank you. For more than a century, hundreds of patients diagnosed with leprosy lived at the Gillis W. Long Hansen's Disease Center. Locals referred to the Leprosarium as Carville, named after the nearby town.
Because we had no treatment, it was, once you got it, you had to deal with it for the rest of your life. And by law in Louisiana, you had to be assigned to the hospital quarantined here for indeterminate length of time.
And some people lived out their whole lives here.
Some people did. Now, some people did begin to test negative for M. leprae, which is the causative agent. It's a bacillus that was identified under the microscope in the mid-19th century by a doctor named Hansen, and that's how later on the disease term changed from leprosy to Hansen's disease.
Elizabeth Shakesnider is the museum curator and a Carville historian. The story of how and why Louisiana operated a national leprosarium begins in New Orleans, where a medical board decided to send the city's lepers to live at the abandoned estate.
Our first patients arrived in 1894. Well, for the first year and a half, they had to fend for themselves. And the reason behind that was they couldn't attract any doctor to live here full time. Hey, Charity Hospital is staffed by nurses from the Daughters of Charity of St. Vincent de Paul. Let's ask them to come and care for the patients. And they did, and it worked. So in 1896, the first 4 sisters arrived, and the order remained on site caring for patients 24/7 until 2005.
The Federal Museum is open free of charge with guided tours available upon request. Exhibits take you through the history and the realities of life at Carville.
This exhibit shows you more or less the furnishings from a patient's room that would date to the 1940s. The government provided all of the essentials, a bed, chair, desk. Anything a patient needed, the government tried to provide it, even down to these fans. We were not air conditioned until the late 1960s.
Carville grew to become a 360-acre self-sustaining community. It had to, because most of the outside world was fearful of contracting leprosy.
We had our own water treatment center. We made our own electricity. We had our own cemetery. We even had a lake for recreation, for boating and fishing. The patients ran their own little kind of five and dime in the recreation building. Now, they got 3 meals a day in the cafeteria, but the patients ran the canteen and they benefited indigent patients. We had one whole dormitory building dedicated to patient enterprises. It was called the Carville Mall.
Carville also imposed its own law and order.
By law, if you left the hospital grounds without a medical pass, you could be put in jail. These shackles were worn by a patient, and he was delivered to the gate by the sheriff. So there was a repeat rash of patients running away during Mardi Gras season, to be honest with you. And they'd go to New Orleans and then come back.
And pay the consequences.
And pay the consequences. The consequences were 30 days in jail.
Residents cultivated a thriving sports and social scene with an annual Mardi Gras celebration and a championship softball team. Carville also published an award-winning newspaper, The Star.
I think in its heyday it had over 80,000 subscriptions. It went around the world. It's also the cornerstone of a lot of the research that we do today. It's all digital and online now.
The U.S. Public Health Service took operational control of the hospital in 1921. The nuns remained, caring for patients as nurses, researchers, pharmacists, and other medical professionals with doctors and staff. Exhibits chronicle advancements in research and treatment of the disease, which causes nerve damage, especially to the hands and feet. It was the discovery of sulfone drugs that eventually freed patients from medical quarantine. So Elizabeth, we hear the quote-unquote miracle at Carville. What was the miracle at Carville?
This is exactly where I tell you what it is. It was in the 1940s, a doctor who became our medical officer in charge, Dr. Guy Faget, he was keeping track of the advances in TB, and he realized there was drugs being used in tuberculosis that he thought could be helpful in the treatment of leprosy. So he asked for patients who might want to volunteer for the drug trials, and he got 10. And so they started the drug trials, and within 6 months, patients began to look better and feel better. And then it became the miracle at Carville.
In the 1980s, Carville officially became an outpatient treatment facility for Hansen's disease. Some of Carville's original residents chose to live out their final years on the property. In 1999, the U.S. Public Health Service transferred Carville back to Louisiana. Today, hundreds of patients are buried at Carville, many under aliases, so the museum has a database to help visitors locate their loved ones.
I might stress, not everyone chose to take an alias, but we photographed each headstone and made a database with all of the names, patient ID numbers, and death dates. We have over 1,000 burials on site.
Grave sites are on view in a self-guided driving tour of the property, along with other points of interest. Louisiana continues to lead in Hansen's disease research, with a national program headquartered at Louisiana State University in Baton Rouge. Here's a surprising fact. Not a single person who worked at Carville nor treated patients with Hansen's disease has ever contracted the disease. Hansen's disease is believed to be genetically linked, meaning that certain people have a susceptibility to it and others have a natural immunity to it.